meetings. So I'll just quickly tell you, I'm Victoria Compton from the San Juan County EDC, and we exist basically to serve the business community. But during this time of upheaval, we're trying to do other things that we don't typically do. So like look for grant funding for businesses or host community meetings countywide to get information and resources out to our community. So that's why we put this meeting together. And Gail, I don't know if you were here for this, but we're gonna record the meeting. There were other meetings that people had to go to tonight, and I don't want this information to be just said during this limited attendance meeting and then be lost forever. So we'll be recording this and we'll have it up on our website in the next couple of days. And I'm gonna hand the mic over to John, who is going to go through the agenda. And John Gomez, John joined us from Orcus, so we want to tuck him into the agenda too as an Orcus representative.
Oh, okay. Well, why don't we start off with John Slater then? We're gonna our agenda's a little topsy-turvy because a couple of our folks aren't here yet, so we'll do this on the fly.
That's great.
Oh, is anybody there?
Yes. Yeah. Hello.
Oh, hi. It's Trish Lehman, and I wasn't able to get on through the video, but I was just calling in and was invited via Robyn Van Hyning. So I just wanted to let you know I was here.
Okay.
Thank you.
Hi, Trish.
It's Curt and Robyn.
Hi. Oh, Curt, Robyn, hi.
There's also Evan and Deanna's here.
Yes.
Hi, Deanna.
Beth Helstein.
Hi, guys.
Yes.
Gomez.
So I'll say it again because we had a couple people join us. We're recording this because there were another couple of meetings in the community around the islands tonight, and so I think we've lost people to that. And so we're going to record this because there's going to be so much great information for seniors during this call that I want to make sure we get it up on our website, and we can send that to you guys too if you want to put it on your own websites. But I just want to get as much information packed into this meeting for resources for seniors, because I know there's a lot out there, but a lot of people don't know about it because they don't necessarily have access to some things. So John, I'll let you go ahead and drive the agenda now. Thank you.
Okay, so Mr. Slater, why don't we give you the floor for a few minutes? You can tell us about yourself.
Yeah, I'm John Slater. I'm with the Orcus Senior Center. I'm the coordinator for the Hearts and Hands program. And just in light of the COVID-19 crisis, we kind of created a buddy check-in program because the home visitation was no longer viable. And so we quickly signed up about 72 volunteers at one point, and we set the goal of reaching out to all seniors on Orcus. We started with voter registration data. We did a public records request, and that gave us names and ages, and then we populated the phone numbers to the best of our ability, and there were about 2,200 seniors, so that was our goal. And we quickly signed up these volunteers, and we basically ended up with about 60 who were making regular calls, and we were submitting lists of 10 seniors every 2 days. That was our goal, to get people just to reach out to the seniors to see if they wanted to participate. And then the seniors who said yes to them then populated their buddy list, and they would then maintain those seniors' weekly calls. We asked for a commitment of 8 weeks, and we're kind of running up against that for some of our volunteers now. But we have, to date, we've assigned 1,922 seniors to be called. The senior intakes, we've asked volunteers to submit an intake form. Well, I should say we are managing this with a relational database. And people are submitting Google Forms for every call that they make. So we're able to capture their volunteer time. We ask the start and end time, comments for the seniors, and of course, if they're up or down, if they're involved or not. And so we have, we've received 1,998 intakes, and that just represents an individual attempt to reach a senior. It's not actually necessarily reaching every senior, but those are the number of attempts. We have currently 55 active volunteers. The program's kind of settled down a little bit. 26 of those volunteers have buddies that they are maintaining weekly contact with. And there are 53 seniors currently that have accepted our invitation to receive these calls. And that's down a little bit from a high of 60. And so we're revisiting age 85 and over. Presently, those are the ones that the seniors that we were previously assigned to be called, but we couldn't necessarily reach them, or at the time they weren't interested and they didn't necessarily indicate that they had a support system. So we're just giving them the option in case they have a different perspective 2 months in, and we're going to be calling those folks now. And then that will be pretty much the end of our intake phase, and then we'll just be monitoring the weekly calls from here on out. So it's been a real boon. It's been a great kind of a morale booster for the island, and many seniors who don't even need the service are pleased to know that somebody is doing it. And we did decide to go down to seniors age 60 and above. So often we were calling each other, but it was very trying. It was quite a huge team effort. And we had some back office people. Joe Simons kind of created this relational database and instituted the Google Forms. My good friend and neighbor, Michelle Vekved, she's managing the Asana program that creates the reminders and keeps us on track. And so it's been quite an amazing experience. And I think we've helped a lot of seniors. We haven't actually made a lot of referrals that we've had to follow up on. Some things mostly about grocery deliveries and mail and that sort of thing, medications. And that was pretty much on the front end. But now people I think are doing pretty well, and they're just enjoying the contact.
That's really fantastic. That's amazing work. Thank you for doing that for the community.
Oh, thank you for saying so. Yeah, it's been a whirlwind. Joe famously said that we were building the bridge as we were designing it.
Yeah, exactly. Every step with a new. Yeah, that's amazing. Good for you. Thanks.
Well, thank you.
And next, we're going to go to Deanna Osborne. I saw you come in. Welcome, Deanna. Maybe give us a few minutes on what you are up to. And guys, just so you know, what we'll do is we'll sort of go through, a little, 3-4 minutes of this is what I'm bringing to the party, and then we'll have a open discussion period once we get through the next 3 or 4 people. Okay.
Hi guys, I'm Deanna, and I just noticed my background is still a picture from Village at the Harbor. Thanks, Evan. So I'm here representing Hospice of the San Juans. It's our local hospice organization here on the island, and we've just wanted to check in, and we're still offering our services. We provide respite care for the main caregiver of a household who's has somebody on the San Juan hospice service. Doesn't have to be Hospice of the Northwest, 2 different hospice organizations. And we also have a storage unit that we have equipment and we loan out to the community, everything from walkers, wheelchairs, bedside tables, bedside commodes. And you don't have to be on hospice to utilize that. So a lot of people in the community call us and get a lot of stuff from us, and it's a great thing. We have 2 storage lockers. We also have a grief support group that we're working out the kinks of the age of COVID for our in-person sessions, but grief support is always available on the 472 phone number, which I will give you guys if you guys want it for your records. Do you guys have any questions? I didn't know how long you wanted me to babble on. And
I do. I've got a couple questions. And I'm not sure if you joined us before. I said we're recording this just to make sure we can get it to as many people as possible.
Yes.
So this is countywide, right?
Yes, it is.
Okay.
We do have volunteers mainly on San Juan.
Okay.
I think we might have 1 or 2 on Orcas, but I'm not 100% sure.
Okay, great. And then let's go ahead and say the 472 number right now. That'd be great.
All right. So the hospice line is a voicemail that you'll leave, and somebody checks the phones daily. All of our folks are volunteers, and the phone number is 360-472-0322.
Okay.
And people can just call and leave a message for if they just need something from our supply closets, or if they need some respite volunteers to come in and just give support to the main family member that is taking care of the patient.
That's really great. So 360-472-0322. Okay,
Correct.
great. Thanks. We'll put that on our website too. And
Awesome.
if you, we can send this recording to everybody in the group later in a couple days. So
Perfect.
thank you, Deanna. That's fantastic. It's great to have that information.
I might interject here if I may.
Yeah.
Since we're talking about mobility equipment, it's also available on Orcas Island through the Lions Club. They maintain distribution out of Orcas Senior Center, and I have a contact person and phone number if you're interested.
Yes.
Okay, his name is Stephen Bentley. That's with a PH, Stephen Bentley. And his number is 310-694-7165.
So 310-694-7165.
That's correct.
Perfect.
And he's with the Lions Club. And you'll call and you can, at this point, you can schedule an appointment to receive mobility equipment.
Okay, great. Thank you. Okay.
Okay, great.
You're the one
Thanks,
with the, thank you.
Thank you.
Next, we'll move on to Robyn Van Hyning.
Hyning.
And you guys are muted.
Oops, here, let me unmute. I'll unmute them. Okay.
I said, you must not be a telemarketer. You got it right the first time.
Oh,
It's Van Hyning. So, so I've had various roles over the last 25 years in the community, being at the convalescent center and with the village at the harbor for a while. But my current career in the last 10 years, it's mostly been running a training company for caregivers. Adult family homes, assisted living, and home care agencies require home care aid certification or CNA certification for their caregivers. And so we created training for that, and it's all online with the exception of 2 days that they do in a skills lab. And we work with Gail and with Barbara on Lopez and with Sally over at Lahari on Orcas on helping try to get more caregivers to provide for, particularly in those cases, for the COPES clients. Normally COPES training, it has to be done all off the island, but we've worked out kind of a workaround where we can get some of the local folks through our program, through some grants, so they don't have to go off island for a couple of weeks. So my focus is mainly training caregivers and supporting others who are supporting seniors in the islands and trying to figure out what we can do to make sure people have the services they need. So.
That's fantastic. Just for those people who don't know, what is COPES?
COPES is the, Gail can probably explain it as well, it's the Medicaid, the welfare program, where if a person has, they're medically needy, but their resources don't allow for private duty care, they can apply to the state and receive some funds to hire their own caregiver, but that caregiver has to be approved through the state, and they're a COPES individual provider. And normally that training has to be done through the SEIU union's training program called the Training Partnership. But if the person already comes to the program with their certificate, they've already been trained before they apply to be a particular individual's caregiver, then they'll accept that training. So that's our workaround, is try to get them certified before they get into the program so they don't have to go off island to do that.
Oh, that's fantastic. That's also really great from a job skills, upskilling people into different jobs here too, because we need that as well. Okay, thanks, Robyn.
Cool. Oh, let's go on to, oh, sorry, Deanna, I see your question.
Okay, I'm going to interject something real quick. I believe all the hospices, all the islands have their own hospice group on the island, on their own island. So I'm pretty sure, I have heard in the past that we have gone to other islands for brief cases, but I'm pretty sure Hospice of San Juan's is for San Juan Island. I just wanted to make that correction.
Okay, that's great. Thank you.
Thanks, guys.
Yeah, and there's a Lopez Island hospice, but I don't know Orcas. I don't think they have many hospice workers. They have Hospice of the Northwest only, I think, but Lopez does have Lopez Island Hospice and Home Support as well. Yeah.
Cool. Thank you. John, who's next on the agenda?
Curt Van Hyning.
Oh, cool.
Everybody on the screen already knows me and my illustrious past, other than John Slater maybe, but everyone else has already been exposed to my 25 years in the islands. I worked at senior services for a while and also at the nursing home for a while. And I did about 20 years as a state health insurance benefits advisor on San Juan and have stopped doing that since I moved to Lopez. But each of the islands has certified, trained volunteer advisors for health insurance, and that's what I used to spend lots and lots of time doing. I've also been a business owner in Friday Harbor souvenir shop, and I'm currently serving, have been for about 10 years now, on the board of directors of United Way of San Juan County. So I continue to serve on that board. And I helped, when I left senior services 8 years ago, I helped establish the Round Towner shuttle service, San Juan Island shuttle service on San Juan, and we're working with the Lopez Family Resource Center and Lopez Seniors and others now to extend that daily ride service to Lopez. So we're working on acquiring volunteer drivers and hopefully an electric vehicle so we can be available on call like the Round Towner is on San Juan Island. So the Round Towner has been there for 7.5, almost 8 years now, and had its busiest year ever in 2019. They provided 5,300 rides to our target population of about 125 seniors who don't drive. It's not just seniors, but predominantly seniors, some disabled folk and some just low income people without cars or who don't drive. And it's a free or donation only service. So we publish a price of $3 a ride, and a few people pay for it, but most don't, and it's not a requirement that people pay. So my role predominantly is grant writing and fundraising to keep the shuttle moving. And as I say, having moved to Lopez 4 years ago, I'm trying to impart that same service here.
That's fantastic. Thank you. Do you know, maybe John or maybe Curt, you might know what's available on Orcas in terms of transportation for seniors?
They do have a program, and I think John probably is closer to it than I am, but there is a program. Dennis, what's his last name, John?
Oops, hang on a sec.
Yeah, unmute him.
Well, everybody is unmuted, so.
Okay. Anyway,
I'm sorry. Yeah, Dennis King is his name.
Yeah, Dennis King is operating a volunteer service for rides to appointments on Orcas, and they've been quite successful. They have a pretty active group. How exactly it's been affected by COVID, I don't know, but I have had meeting contact with Dennis, and he's very enthusiastic, and it's from my understanding, it's a successful organization. Not quite the same model as the Round Towner. The Round Towner, it is a call and ride door to door any day, and the Orcas system is you call and the group, the organization, find you a nearby driver, hopefully in your neighborhood, to take you to your appointment. So it's a little bit different in the assignment of a group of volunteers instead of one primary driver. John, can you elaborate?
Yeah, that's correct. They will, I think if you give 24 hours notice, they will try to find a volunteer driver for you. And many drivers do drive people on a regular basis. They become familiar with them. I think there's been a change of, I think the door-to-door is now kind of under the auspices of the Orcas Island Community Foundation now, instead of Lahari.
Okay.
So I think Dennis King is not overseeing that currently.
Okay.
Okay. Just writing everything down. Okay, great. Well, thank you. Thank you, Curt, for that. And John, thanks for clarifying what's going on Orcas.
Evan, you were, I'm glad you were able to join us. Did you want to speak, or did you want to just listen on this one?
I'm the administrator at the Village at the Harbor, Robyn's former position. I seem to follow Robyn around the country. But yeah, I've been at the Village now for about 4 years. I'm sure most of you are familiar with what the Village is. It's been in business since roughly, late 2008, and is a full service senior living community.
Great, thank you. Thanks.
And then we have Gail Leschine-Seitz from the County Health and Community Services.
Yes, hi everybody. I know everybody except John. I think I met John, but both Johns I haven't met in person, but I've seen before. So I work for Senior Services, San Juan County, and we provide meals. I guess you guys have already spoken about some of the other things we provide. We work closely with Round Towner because they do provide rides to seniors, and I refer lots of people to Deanna, even though we don't talk in person. I'm always trying to find caregivers for clients. So one of the things and Robyn as well, because we need more caregivers for clients in their homes. So that's one of our big needs. And we're constantly, and I did speak at the CDC jobs fair Zoom meeting about trying to get more caregivers, and I got a couple little inquiries and haven't had a lot of follow through yet, but I did have some potential people interested, and right now the rules for training are different because of COVID, and are easier. So really somebody signing up right now would be an awesome thing, because they don't have to go over to the mainland to get fingerprinted, and they don't have to take a test for quite a while, and they don't have to complete the training in a certain amount of time. So it's like time for people. So if you know anybody who's interested, it's like a good time to train. And we have lots of clients, so no dearth of hours. So we do all the the senior services on all 3 islands do meals, and we did have in-person meals until COVID. And so a big focus right now is home delivered meals, because people are supposed to stay put and they need help and services. And so on all 3 islands, home delivered meals has increased the amount we're doing. And also there are amazing meal programs, food programs on all islands, getting more food out to seniors, getting as you guys know, deliveries of stuff from the store, and Round Towner has been helpful with that too. And then the Family Resource Centers have worked very hard to get those going, those delivery of food going. We've had deliveries of fresh food through a number of programs as well. So trying to make sure people have what they need in their homes, and basic household items as well has been provided. Food bank deliveries have been made on all 3 islands to people's homes, so they don't have to go out for that either. So we were really trying to keep people in place and keep people healthy, and it seems like it's worked really well. Countywide, people have worked really hard to keep us all healthy, and that's been awesome. I'm also on the EOC, the Emergency Operations Center, which has been kind of the cornerstone of figuring out all the planning around COVID, getting PPE equipment, doing testing, finding facilities that might need to take people who would be positive. And I guess we'll all get to see if it gets tried out at all now that our accommodations are open as of tomorrow. Our transient rentals and our lodging accommodations are open 50%. So we'll get to see, hopefully everything will, all the things put in place will help keep us under control in a good spot. So that's been amazing to be on that committee though, and to see how all the hard work that's gone into what's happening right now for everybody, trying to think of all the populations that have needs. All the senior centers have mobility equipment programs, whether it's through them directly or whether they do to it. So mobility equipment is available on all 3 islands. Usually the hospices on all 3 islands provide the other kinds of equipment like bath aids and bedside commodes and that kind of thing. I think on Orcas it's all together in one area, just all the equipment is all together for with the Lions. Is it the Lions Club that does it, John? Yeah.
That's correct.
Okay, yeah, so we all have that. And then there are rides available, have been historically available through the senior center to take people to medical appointments and to take people to off-island medical appointments. And that is coming back in a various levels at this point. Lopez is offering that to some extent. The Round Towner is kind of covering for a lot of the things happening, I think, on the island with that, and Friday Harbor with that, because our senior services hasn't started using our because we have mostly senior volunteers and they can't really be driving other people right now and be exposed that way. So it's been hard because a lot of our volunteers are seniors. And some of our staff are seniors, you know, it's just like amazing. So there's a lot of seniors in the island. So we're trying to figure out how to keep seniors safe while at the same time serving seniors in our program. So that's been an interesting discussion we've been having kind of consistently. So besides just in general needs for seniors that I see are seniors need caregivers, like we've talked about. Seniors need housing, and I think that in the island, our 3 big things we work on all the time with seniors is caregiving, transportation, and housing. And housing is also an issue, obviously, for other populations as well. But there are few low-income apartments on all the islands, and even fewer ground level apartments on all the islands that seniors can afford. Luckily, seniors have a fixed income, so they haven't been as affected by COVID as people who lost their jobs, but some of those fixed incomes are so low that you could never afford a rental, and most of those rentals in the islands that used to be like a little cabin in the woods for $600 are gone now, and not really that safe anyway for our senior population a lot of times. So housing is our next, is a huge thing to work on for seniors, but it seems to affect everybody in the islands. And it's because even with volunteer issues that go on, I mean, there's a lot of seniors who live with wood heat and can't cut wood and can't, you know, get wood and can't bring it in anymore. So a lot of, I know on Lopez with the home care, there's like a whole category for splitting wood for people. I found a little bit more here in Friday Harbor when we asked if people wanted wood delivered to their home or something. There were fewer, but Lopez, boy, there's a lot of wood burning stoves on Lopez, especially with seniors. Those in-home services are important, and I think they've been a matter of concern for seniors as well, because they've had volunteers and neighbors who do that, and now with COVID, volunteers and neighbors have had to stay home and have had to keep away from, you know, possible infection with seniors. So it's been tough to get people services they need, and I think isolation is a factor, and I'm impressed by Orcas's program. On Lopez, I think a lot of the service organizations have covered the calling quite well. In Friday Harbor, we had a lot of people who didn't want to be called, but then when they get their home delivered meal, they want to talk to the driver for quite a while. And when they get their groceries delivered, they want to talk to people for quite a while. So I think they were kind of hesitant about what is it like to have somebody call and what would I say? But then when they do have people show up in person, they really like that context. So, and we've had some churches who are willing to reach out as well. And that's been for people who did want to call. We've gotten people on those calling lists, and that's been quite successful. And people have been pretty happy with that. And then our organization and the Family Resource Center call out quite a bit to people as well. There's an Island Neighbors program, which is a lot like Hearts and Hands on Orcas, and those are volunteers that work with folks. And a Lopez Island home hospice and home health, home help, they also have volunteers that were going to people's homes that were still calling even if they weren't coming out to the home. So I think in the islands we've been pretty good about reaching out to isolated folks and then offering the services time and time again for people who wanna sign up for those. So I think people have been a little stir crazy, but not without somebody checking in on them.
Gail, can I ask you a question?
Sure.
This is Curt. We haven't mentioned the vulnerable populations group that you lead and that has been so helpful to me in getting people active on Lopez and working toward transportation program here. And I thought you might want to mention that group, which I didn't join it at the beginning, and I think it's probably been going on for over a year. So maybe you could share a little bit about the vulnerable population.
Yeah, that's called the Community Health Initiative Consortium, I think. And it was, and it has been, our main focus right now is transportation and caregiving. And it's been going on for quite a while, involving, it's here on this island, and yet we've also had people from Orcas and Lopez participate and have really wanted to help them build, having their own consortium. This is with Peace Health and EMS from here, and then and driven by Peace Health's initiatives that they had through the ACH, the Accountable Communities of Health. Oh my gosh, I can't believe I'm remembering these acronyms at 6:30 at night. Anyway, but they've, you know, it was started to think, okay, how can we serve vulnerable populations and what are their needs? And I think it was actually a directive when Obamacare came about to have these kind of work groups. And so our work group has been, has involved a lot of people on this. I mean, Curt's on it now, Evan's been on it, and Beth's been on it, and all the family resource centers are connected to it. All the hospices have been, Marilou's comes almost every time we have it, and then we've had a couple community members too who serve seniors. And so that's a work group. If people are interested in senior issues and want to work on them more, it's certainly a think tank for whatever comes our way. And so we have been chipping away one issue at a time, and happy to welcome, you know, Curt to the table and get going on the transportation in building that program. And then we also have housing down as an issue. And I know here we're trying to combat a couple of the problems at a time. And I know Peace Health had talked about potentially building some housing for caregivers, for healthcare workers on their property that could be a subsidized, you know, lower cost housing, because they're always looking for caregiver, you know, workers as well, healthcare workers as well. And so that could cover a couple areas of need. But we need to solve that problem countywide for sure. And it's issues that always come up. So the county certainly is aware of many of the senior issues and are working on them in some capacity as well as they can. But there's certainly challenges that we face all the time. And we usually have it's usually creative solutions that come about. It's usually not, you know, off-island programs that we can connect to very well. We have to kind of make it ourselves. So it's happening, I think.
Hey, Gail, what kind of housing capacity for seniors do you think that we would be, you know, in a perfect world, that we would, if something was to appear overnight on all three islands, what are we looking at?
I think Evan might have a different view, and it'd be great to hear his view as well. I think the apartment building situation where you build a lot of housing at once in a smaller space is probably the most doable, quickest. I love the idea of let's you know, commingle people and have them in communal living, and I love that idea. However, every time I even have a caregiver who has a room in their house or has a whole floor in their house that they could accommodate a caregiver, I can never find a caregiver. There's never a match that really works that well. So I'm frustrated with kind of trying to the communal living. But you know about micro housing, right, Evan? Do you want to speak to that?
Yeah, I do sit on the Inter-Island Healthcare Foundation, and one of the things that we're doing right now is actually in the process of finalizing our feasibility study for long-term care options for the entire county. And one of the things that's on there is, you know, I'm particularly interested in microhousing and how that relates to affordable senior living. I honestly, John, I don't have the answer for you as to what I think unit-wise yet. I think we're probably about 2 months away from really finalizing the feasibility study. And that is a compilation of a tremendous amount of data from DSHS and the state that will really take a look at the specifics of this county and what we can do reimbursement wise from the state and Medicaid, and really look at what we can do for affordable housing. But I know that what I've studied from the micro housing is, I think it's a fantastic idea. I think where our biggest gap right now is, truly as a county, is the fact that we have people that I don't think are opposed to being caregivers. We need to figure out a way to about double the wage to make it effective and to really attract people to this industry.
So we're really looking at it. Maybe the caregivers aren't homegrown here in the county necessarily. It'd be getting people, you know, convincing people to move here.
Well, one of the things that we're looking at really as a foundation is creating micro nursing homes. You know, we've kind of followed, I think, pretty closely the greenhouse model or the greenhouse project, and looking at building a micro nursing home on each of the main 3 islands, including micro housing for seniors, like, you know, kind of handicapped accessible options for vulnerable adults and what have you, and including some housing as part of that for workers, and building a better pay model. I'm not sure how that's all going to work out yet. I mean, that's been something I've been trying to solve for about 23 years now, and I don't have any clear answers on how to pay staff more money and make your business model work. But, you know, hopefully, like I said, all the data and everything that we're collecting right now, and the fact that we're in line for a couple of different grant opportunities right now will put us hopefully in a good position to trial some of these options and see what happens.
Well, you know, Lahari is working on that very thing, the wages issue, because it's a tremendous one. People can't afford to live here on what they would traditionally get paid for a home health care aide position.
No, and I would never tell my staff this right now, but I wish that I could double their salary. I mean, if I could do it financially, I would do it tomorrow. They're worth every penny, and the work and the love that they put into their jobs is breathtaking. But, you know, the reality for me is to make my business model work, it is what it is.
Right. Well, and so are you familiar with what Lahari is talking about? And since they're not here, would you be willing to talk a little bit about that?
Well, I haven't actually talked to Dennis in a little while, but I know that Dennis was actively pursuing a home care agency. If that's...
Yeah, exactly.
Well, Dennis has left the Lahari, so there isn't any forward progress at this moment on any of that. Unfortunately, because a home care agency would be a start, but I think it's advocacy at the state and federal level. And right now it sounds like healthcare worker salaries are going to be increasing some, partly because of what's been happening with COVID and the realization that of what the healthcare crisis is. Because the truth is, all those nursing homes that had COVID that spread is because forever nursing homes have not been able to get enough good quality staff going in anyway. And so they were already falling down on their regular requirements. And so then when this came along, they just didn't have any, they weren't even having the regular amount of needs being met. It's for safety concerns. So I think it shed a light on, hey, this is a big issue that needs to be dealt with, and finding people who will do the job for one thing, and then having it be a safe environment for people and not to wear them out is another thing. So I hope that that gets looked at on a bigger level.
Well, I think that, I mean, to be honest, you know, not to take up a big discussion, but healthcare as an entire entity right now is really the only hope out of this COVID situation is that it dramatically changes. Nursing homes have been under fire for years, and over the last 2 years alone, we've lost almost 21 nursing homes in the state of Washington. And it's because financially they can't make it work. The reimbursement models aren't right. The staffing models aren't right. I mean, none of it's working. And that's a huge concern. Part of the foundation, part of our business model includes bringing nursing home care back to the county, It also includes micro-housing for seniors, Medicaid housing. It also does include a business model that would include home health and home care. So that is something that we are actively working. And my hope is later this summer, we will find out for sure that we're in line for a pretty significant grant that would allow us the money to actually fund a home care agency, if we can work out the details on that.
That's great.
That's awesome. I have one more thing to say about just housing in general, that one easy thing that can be done on all 3 islands is not to lose the housing we have. And so because the apartment complexes come up to a date when they can be purchased by private organizations, they only have to be state funded and accept the RSD, the subsidized housing for a certain amount of years, and then they can be sold privately. And like one of our apartment complexes got sold and bought by a private organization, and they could charge whatever they want. So we need to stop letting those slip away, and that needs to be purchased by some organization that will keep it at a lower income, like the Opportunity Council in Bellingham. Or I mean, they were trying to work with different organizations that might be in that field. The county said they can't possibly manage apartment complexes, but that they are very interested in trying to keep the housing that we have. So not losing that is one step, and then building, more housing that's particularly focused on seniors is another thing, but low income is another obvious challenge that we have, just folks who can't afford the crazy housing costs that are on the island.
Sure. Yeah, we've had this conversation with Safe San Juan's too, for their, people that they're trying to not relocate, but move into
Support,
longer than 3 days, of the transient housing that they can provide, and then you either have to go back to the person that caused you to leave home in the first place, or you're homeless, and it doesn't seem like a tenable solution.
Yeah.
But yeah, it's everywhere.
Yes.
So the Opportunity Council is in Bellingham. That's who the county would kind of lean on for this to facilitate the purchase.
It's one organization that has worked with them
Okay.
closely on those kinds of issues, and that they've talked to. I'm not sure where we got with that, but it does seem like we need that.
I believe they did buy that one apartment that came up last year.
They were thinking about it, but Ad West finally bought it. Ad West out of, I think, Kirkland.
Was that like a bidding war kind of thing, or was it just a...
No, they didn't have necessarily the wherewithal to do it. So I think they had the money, but they didn't have the staff or something to make it actually happen. So it did slip away.
That's something for all of us to keep our eye on and try to impact when it comes up.
And not just low-income apartments, but low-income or affordable homes that get scraped and turned into McMansions.
Yes.
There's a ton of that kind of building around here as well.
Yeah, and that's been a big discussion about co-housing. Can one of those houses be bought and then rented out, and people can live together, and there can be co-housing where the rent is less in a bigger space. And that's all great stuff. Just so you think about the organization of it and the matching of it and how it all works is a little overwhelming. So it's too bad. If we want to talk about housing anymore, Ryan from the county's an awesome resource, and he's working on affordable housing and the homeless issues that are going on. And we've got that tax going on, right? So we've got a housing tax going on that's going to support building housing. And there's already 2 places that are slated to be built, I think. And I can't remember locations and whatever, but so that's happening. So we did get that tax. So there's stuff happening in every area, I think, and growth and potential. So that's good. It's just, will it catch up with our need?
Yes, exactly.
But was that a tax levy, or was that a sales tax increase?
That was it a sales tax levy?
It's a real estate excise tax.
Real estate, okay.
Oh, okay.
Good. Right. Yeah, sales tax. We're hurting a little bit right now.
real
So
estate too, but
does anybody have additional comments to add to what everybody's up to? So we're sure to capture all of that in the video. Any thoughts or things you've heard of other people doing that might be handy in this encyclopedia, miniature encyclopedia?
If she has anything.
Beth, did you want to talk about senior programs with the library at all?
Thanks. Good one. Yes.
during COVID, the library was forced to step back, but we have been offering Zoom programs for people who do have computer and internet access. We have 100 people signed up for or close to, for the geology of the San Juan's workshop next week, and have had the Mulla Center book club meeting regularly via Zoom, and that also is next week. We've issued e-cards so that people who can't physically come to the library can borrow electronically, again, if you have internet and a digital device. We are hoping that the county will go to phase 3 soon, and we can begin providing curbside delivery of what we're going to call holds. You can phone in to place requests for materials if you don't have a computer, or somebody can help make that happen for you, so that you could drive through and pick up library materials. And we're planning actively now to make that work when the county moves to phase 3. It might not be the first day of phase 3, but it will be shortly thereafter. And be able to, at least to provide printing, remote printing, that we could also do via curbside to bring out documents that people send to our printer electronically.
Wow, that's amazing.
Great.
And Tech Tuesdays, are you still doing techie stuff for seniors by phone or something?
Very in-person thing, and it involves touching devices, which you may know that your cell phone is the dirtiest thing in your possession. So we don't know when that will resume at this point. We are looking at software that would enable us to get into your device and guide you through it, as you've probably seen in certain online trainings and things.
Right.
I don't know where that is right now, but it's something on the table for consideration at the library. I'm also on the board of the San Juan, or the Joyce Sobel Family Resource Center here on San Juan Island. And we have received a significant additional contract from San Juan County to help with rental assistance during COVID. And the Family Resource Center has also got a large number of people for whom they're delivering household essentials, toilet paper, shampoo, types of materials to their door through our Island Neighbors program and the driving that we're doing. And that's probably going to be shifting, because some of our driving to some families was through assistance through the San Juan Island School District, which made bus drivers available. But when school's out, that's going to change how that happens, to deliver both food and other pharmacy or household essentials. Will be more through neighbors, and we're figuring that out at the Family Resource Center right now. There's also energy assistance. Project PAL at Opalco now is contracted, at least on San Juan Island, through the Family Resource Center. So we have increased energy assistance available, rental assistance, nutrition assistance, household essentials, specifically for seniors. I mean, for everybody, but those things for seniors as well.
And I know the town of Friday Harbor has the Life Ring program that people can get abatement on their utilities as well, or not power, but on water and sewer.
Right. There's also prescription assistance, a small amount of funding for that. And also through San Juan County, through the Family Resource Center, there's a grant for, or a contract for providing mental health counseling.
Yes.
And I know that stress is huge in COVID.
Yes.
So
everybody should reach for those things. People should reach out to their family resource centers on Lopez, Orcas, or San Juan Island, right?
Right.
Okay.
Interesting that the tech thing, because you know one thing we've been dealing with at EDC for the last 2 months or 2 years, it feels like right now, has been we have so many older folks who are going through trying to deal with getting the SBA loan programs or filing for unemployment for the first time, maybe ever, because they've been working and their business is closed, or their job is they've been furloughed, and even if they were only working part-time, they're still eligible under the CARES Act to apply for unemployment, and it's some decent money. But we've spoken to a few people who don't have access to computers or find have found it challenging, and we've been challenged by having to direct folks more or less to, especially when it comes to unemployment, because that's all done online unless you can call and get through, to have to rely on a relative who can help them with it and that kind of thing. And we reached out to a number of agencies in the county early on to find out if there was anybody that could provide assistance on those kinds of things, and never really got any traction on it. But it's one of those things.
Historically, that's been the job of public libraries, and COVID just turned that upside down. And
I know it did, and it's unfortunate.
Computer assistance is very much, I would say, in about an 18-inch space. May I touch your mouse? May I have control of your mouse? And you're face-to-face looking at the same screen, and just not really something one can offer right now.
Yeah, we had to keep stopping ourselves from saying, go to the library. Oh, wait, no.
We will be not reopening, providing curbside service without offering computer service, at least for a couple of weeks probably.
Yeah.
And when that does reopen, it will be less. The Family Resource Center will have an intern this summer who is on the San Juan Island Resource Center working to make herself become an unemployment specialist as fast as she can.
Really? That's great. Okay.
In about 3 weeks. So she's not here yet. Needs housing.
Yeah. I have to say there's not many things more frustrating than trying to teach a senior how to access things on their phone and on the computer. I've spent hours with my mother, and then she learns something, and if she doesn't do it the next day, I have to start all over again the day after that, because she just forgets. So, and the phones, the equipment is so hard for seniors anyway. I have so many lines, half-blind seniors who just can't use stuff, and it's just, it's really frustrating, even just Social Security online and Medicare online and My Peace Health online, or the doctor's appointment, the doctor's portals that you have to use, I feel like. So it's hard enough for, I think it's hard enough for everybody, but it's particularly frustrating for seniors. So it's been a big issue with refunds and all that going on. Seniors have been asking constantly for
I've been pushing
help
as hard as I can to make computers and computer access available. We will be getting like keyboard skins in the library, but that still won't make anybody want to come up and touch your mouse or get their face close enough to yours to see what it is you're trying to do that you're not doing correctly online.
A question. Go ahead, John.
Oh, I was just thinking, well, because, not for nothing, but there's a very good chance that we're going to experience this all over again, in the late fall and winter. And, because we're fortunate now to be able to open up to, phase 2.5, right now, and go to phase 3 in about 2-3 weeks, maybe. We have an opportunity to sort of figure out some of these infrastructure points that we found, need support. And we've got a few months maybe before the next round of this to figure out a way to, if we have store owners that are going back on unemployment or going on unemployment for the first time or need help with these kinds of programs, things that we can only do so much working remotely. Knowing that the Family Resource Center has an intern coming on specifically to help with this summer is an amazing thing. But overall, we've got a lot of planning ahead too, and before we have deja vu in November.
One of the ideas that I've thought about is very inexpensive Chromebooks to make available that you could just let go of for a month or two and then sanitize carefully when they were returned.
Sure.
The library did just receive funding to double our Wi-Fi hotspot lending program just before we closed. And we won't have, I don't think we'll start out by lending those because the San Juan Island School District jumped in and provided Wi-Fi to so many homes that didn't have it in the past. But so this conversation is nudging me to remember to ask, where are we with getting those new hotspots online? But as a community, what do we want to step forward and invest in some Chromebooks that we can just say, go to the library parking lot?
Gail, is DSHS still sending the community service vans, or is that stopped because of COVID?
I think it stopped. Do you know, Beth?
It was, I know when I was working at the senior center and that program was just getting started up, it was one of the greatest benefits to me and seniors who had detailed Medicaid or COPES application challenges, which is a lot of them. Let's say half of the people that have to do it have a really difficult technological challenge. And if you can get them seated with an expert in that service van, the people are so good that it just melts away. It's such a magnificent service.
Yeah, I don't think it's going to happen for a while, unfortunately.
Yeah, I don't know how it could work remotely, but the competence of those people face to face is so incredible, and it's so hard to get seniors over to their offices. I think the remote service unit, I always thought every time I saw it, it was this godsend, and why can't it be here twice as often, and now of course it probably can't come at all. But anyway,
yeah, and just so you know, so all of you know, I can do applications for COPES. Now it's online and it's pretty easy. I just do them on the phone. And the workers, the COPES workers, I mean the DSHS workers have to come over here and serve their clients. So they're often doing reassessments and often coming over for and lots of things. So I think they've had to trump that up, and they've had to take on clients quicker, and they have fewer requirements because they've had to really act on some situations that are, high need situations. So I've had good results with people following through, which is good.
Sounds like you think those needs are being met. That's good to hear. Thank you.
Ish, yeah, I guess.
Well, thank you, everybody. It's 7:01, and I don't want to keep you longer than you signed up for, and in some cases didn't sign up for, so thank you.
Thanks.
And we're going to go ahead and put this on our website. And is it okay if we put your contact, phone number, or email, and maybe just send me a quick email, or let's send John an email to let him know what you'd prefer, whatever goes on the site, the contact that you would prefer to go on the site. And thank you for everything that you're doing in the community. If you need anything from us, reach out anytime. And thank you for being here tonight.
Sure. We had a couple callers that came in. I just want to make sure that if there were any questions.
Oh, yes.
Everybody's unmuted, but yeah.
Trish, was there anything about Hospice of the Northwest you wanted to add, since you just retired from there?
I'm gonna have to leave
Robyn.
the meeting, guys.
Okay, no worries. Thank you, Gail.
Yeah.
Okay, thanks.
Thanks, Gail.
Yeah.
I'm not sure I have anything. This is Trish Lehman, and I did just retire. In fact, I left, unfortunately, my job with Hospice of the Northwest because of the COVID-19 situation and being 67 and having a high-risk husband, and that was difficult. But, you know, we're still providing a great service out here. The bath aid's able to come out. Well, now she lives here. We don't have to have one come from the mainland. So we have full-time bath aid for Hospice of the Northwest, and spiritual care comes out, social workers as needed. They're doing lots of phone visits. And of course, Catherine Clary, who is the full-time Hospice of the Northwest case manager, lives out here. And then there's a full-time RN for Hospice of the Northwest that lives on Orcas Island. So they've been providing amazing service during this time. And so that's about all I know in that regard. And, you know, I guess I'd just like to chime in. I'm also a hospital district commissioner, and one of our hopes in the near future is to start working on aging in place and trying to see what we can do, you know, and we don't have anything specific right now, but we're working on strategic planning for the future, and that's on our radar, and something that I particularly am very interested in. So it was really wonderful hearing what everybody's doing. I'm really impressed.
Well, thank you, Trish.
And this is Natalie on Lopez. And my sister-in-law has just gotten out of the hospital in rehab. And we're kind of, where do we go to find her help? Like, she has the agency sending PT and OT and a nurse, but she needs other assistance. And somebody said there's no COPEs available. Nobody's available on Lopez. But who's the best source to go to set up, find people to help her needs, like when she needs laundry or to help to clean her house, because she's had an operation on her arm, so she only has one hand, one arm available right now.
My guess is that would have been Gail, but
yeah, I can chime in a little bit on that because, and this is Trish Lehman. I used to work for 13 years in home health out here on all the islands, and I just had a call from a friend who has a friend in your same situation, who lives alone and had a stroke and is low income, can't afford $35 an hour for a private caregiver, does have home health, so she's got a physical therapist and occupational therapist, but she has no way to bathe and nobody to help her. And this friend called me to say, what can we do? And so the biggest challenge is there are no people to do the COPES work because the pay is so low. So you can apply for COPES through senior services, and Gail Leschine can help do that. But the real challenge is finding someone who can do the work, and that's one of our biggest gaps, I think, here in the community. It makes you just super sad. I don't know. Anybody else want to chime in on that?
If I could just chime in for 1 second, this is Evan, Trish. this isn't going to help Lopez, but one of the things that we do have at the village is I do have 2 respite apartments that we keep that are available for anybody that needs emergency help, anybody that needs to, a place to recover. And I work very closely with Gail. We have a program through the Northwest Regional Council where I have a contract with them that they actually, depending upon people's income, may pay for up to 2 weeks of a stay at the village. And one of the things I'll say is that we've just done this quite recently during this pandemic for several people that could not be at home, could not secure caregivers to come into their homes. And we've been able to get them a place to stay, and also have our care staff obviously help their, meet their needs, help them with whatever that they need. And so Gail and I work on that program together. Gail is much more versed in that than I am, but I just know I signed a contract and we're good with that. I try to stay out of the details, but we do provide that emergency housing for people that need it. And then I will also say that we do have a couple benefactors that help support me keeping several people at the village at the harbor through donations, monthly payments to help people afford to stay at our community. So I'm willing to work with any situation, and especially if it's an emergency basis, just let me know and we'll do what we can to help out.
And Natalie, I can go ahead and I've got your mobile number on my screen, so I'll text you Evan's and Gail's contact information. Is that all right?
Oh, sure. Yeah. Yeah, because like you say, we're just in that situation of she needs help. And again, yeah, because the caregivers aren't really, it hasn't been 2 weeks since she's been on island. So, the caregivers can't really go in except for the home care, the agency people. But yeah, it's just sort of, we're kind of feel like, well, how can we help her, besides just family and friends? But it's a real challenge.
Sure.
I have a question. John Slater, can Friends and Hearts and Hands, whatever you're called on Orcas, can you help with the laundry aspect and things like that?
Well, not currently. We're not.
You're not going in.
Right.
Yeah.
But that ordinarily, that's something that we could do.
Mm-hmm.
Does that change with the phases, John, or is that something independent of phase moving?
Well, we're following the phases closely, and it's going to be the seniors that are going to be the last population to be welcomed back into the community because they're most vulnerable. So senior centers will be the last things to open, probably. So I think we won't be, Hearts and Hands won't be going into our care recipients' homes until that happens.
Okay.
Okay, everybody. Thank you so much. And as before, if you have any more questions, you can reach out to John or me. It's either john@sanjuansedc.org or victoria@sanjuans.edc.org. And we'll try and get people to the right people or cross-connect you, whatever needs to happen to get what you need.